This just into the Fox newsroom. Some new numbers from the Congressional Budget Office. The CBO estimates that group insurance premium prices in 2016 would go up about 10 to 13% under the proposals now on the floor of the U.S. Senate, 10 to 13% over what they would be under current law. However, there is a caveat to that. It says that most of the people who would be paying that kind of money would get some kind of government subsidies, in effect, that would help them take the price down below what they're paying now. Let's talk about it with Penny Lee, a former senior advisor to Senate Majority Leader Harry Reid. Ron Bonjean is a former chief of staff to the Senate Republican Conference. All right, so I guess there's sort of good news for both sides, depending on how you like your health care served up here, Ron. On the one hand, CBO says costs are going to go up, no question, under the proposals now in front of the Senate. On the other hand, most people are going to like, I guess, the fact that the government subsidies would kick in and help them pay for it, huh?
Yeah, well, you know, the fact that the costs are going up should be alarming to people. And what should be more alarming is that there is a USA Today Gallup poll that has Americans, independents, overwhelmingly against the Senate health care plan, which means there should be more people now against this plan as the costs go up. We're talking an almost $1 trillion health care bill. CBO is now saying that it's going to go up 10%. In addition, CBO has said that family premiums would go up $1,000 as well. So as we kick off the health care debate, I don't think this is very good for the Senate Democratic leadership at this point.
All right. So, Penny, would you say that Harry Reid, I mean, you know him well, does he continue down this path of trying to get it passed?
Sure, absolutely. I mean, healthcare reform is needed in this country. You know, it is continuing to rise, and we needed to address that cause. What this bill is also saying is that we're going to bring some stability and security back to this healthcare system that we have, and that is absolutely needed. So he is going to go forward because a public option is one of the things that Harry Reid has advocated for, is needed to bring competition to these insurance companies, to allow them to bring the premiums down. And as this bill is also saying, is that we're going to bring those that have pre-existing conditions, they're not going to be denied anymore. So this is a good, strong bill that is a good, strong starting point, and he is going to bring it to the floor today.
Public option competition for insurance companies. What do you think, Ron?
Yeah, you know, I think the Democratic leadership is really focused on the public option and trying to get Senate Democratic moderates on their side of the field. But you'll see Republicans focusing on the costs, which is the real danger here. I mean, just today, Senator McCain has an amendment up to focus on the fact that the Senate bill cuts $500 billion in Medicare spending to pay for a huge, a huge new government program. I think that you'll see Republicans further that argument this week, keep focused on the spending and the costs, and the CBO score today certainly helps that argument.
Penny, how about how all of this gets done? I mean, President Obama promised, transparency. He was going to put the debate on C-SPAN. Isn't so much of this being done in Harry Reid's office behind closed doors?
Well, President Obama is the president. He's no longer the Senate. And this is something that way the Senate works. It is not behind closed doors. You have had more hearings on health care reform than you have probably of any subject to date. You have had a full transparency. Yes, there's conversations that go on that Senator Reid must have with his members of his own caucus. But what you're seeing forward, that the amendment process is out there on the floor, the speeches are on the floor, the advocacy is all out in front. So this is as transparent as you will see ever on the debate in the Senate.
Ron, a quick thought from you on transparency, and I'll give Penny the last word.
Yeah, it took 6 weeks for Senator Reid to produce a bill behind closed doors in his office. He took it, he molded it the way he wanted to do it. He pushed aside Senator Olympia Snowe in the process. And, President Obama said this would be a very transparent process where everything would be on C-SPAN. Well, clearly that's not the case at all.
Penny?
Well, and Republicans have the opportunity to join us still in the debate, and we hope they will, to bring real meaningful health care reform coming forward.
All right. Penny Lee, Ron Bonjean, thank you both.
John, we're watching a developing story as Somali pirates have attacked yet again, and this time they've hijacked a massive oil tanker headed to the United States. Plus, a little girl makes a huge discovery at a park